Shaitanurajim. Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Sallallahu alaihi wa alihi wasallam. Very Honorable Dr. Abdul Khaliq Sahab, very Honorable Executive Director Professor Rana Imran Sahab, our Honorable Vice Chancellor Zambu Professor Tanveer Khaliq Sahab, Principal Dr. Waqar Sahab, and very Honorable guest from South Africa Dr. Nikki Oloto. Distinguished guests, ladies and gentlemen, doctors, professors and students, people from the media, to everybody, Assalamu alaikum ji. It's a very privilege for me and honor to witness this gathering. It's a very noble cause, very important gathering right now, like all the experts and the professors and VC has mentioned about the miseries regarding this burning issue here in Pakistan, the way people are being treated, the causes of these burned cases and mismanagement after this happens, and very high rates of people dying in it. Well, in Pakistan, like I've been mentioning it since, to be very honest, I understood this whole medical care, the health care system of this country. I was not speaking in 2-3 months since initial days of my 2-3 months, but I just tried to grasp the knowledge and understanding the what's happening, what is it all about. When we talk about the health care, what does it mean by health care? It's because I'm not a doctor, neither have run this sort of portfolio before. My responsibilities have been different for last 3 decades, been the mayor, the IT minister, senators, and now holding this responsibility. So it's not just me who conceived this whole thought. I just got it rectified from the experts from not only in Pakistan but all over the world, and which I normally talk, and my policies are surrounding these thoughts, and that is today that when we talk about the healthcare system of this country, that means we have to first stop people falling sick. We have to go for prevention, and we have to reduce the burden of patient, burden of cases, burden of people falling into this crisis, and that doesn't happen within the boundaries of the hospital. It happens outside the hospital. So when we talk about the healthcare system of Pakistan, it starts from the birth of a child. It starts from the vaccination. It starts from the taking clean drinking water, and so on and so forth. And like it was mentioned just by by the Vice Chancellor of this university, that many cases coming of our girls, our daughters, of acid burning cases. So what hospital got to do about it? Hospital is there to treat, but shall we just have the state of the art treatment center and leave that causes of that burning aside? No, that should not be the case. We have to just go back and trace down and find out the causes and stop that. No matter how state of the art facilities you have in this hospital, none of the patient would like to fall sick and got into that accident and come and get the hi-fi treatment from you. So the idea of this whole entire healthcare system of Pakistan is to stop people falling sick, to go for prevention. Like we have been hearing this whole thing since the childhood, that prevention is better than cure. 68% people who are in the hospital, 68% diseases are the waterborne diseases, and that has been like when I was the mayor of Karachi, I've been hearing this thing from the doctors, but never thought this way. Today when I look at this whole thing, that means what? If you just take one single line, the 68% diseases are the waterborne diseases. That means if we provide as a state clean drinking water to our people, so 68% of the burden of the hospitals will be reduced. 68%, huge burden. So how much we will save? How much miseries will be saved? But what's happening today? Are we putting any efforts on clean drinking water? No, that's not the case. A person or family or house or neighborhood, right, or the first neighborhood of Pakistan, which is top on the mountain in Gilgit-Baltistan, when they flush their sewage button for the sewerage in their houses, that sewage comes out from that neighborhood and it gets contaminated in someone else's water the next door or next neighborhood, and then their sewage water is going out without treatment and getting contaminated in someone else's water, and that's the case from Gilgit-Baltistan to all the way to Karachi. So entire country is drinking each other's sewage. There's no sewage treatment plant concept of treating and then throwing out their sewage, and we're calling 68% diseases are the waterborne diseases. So, and that doctors are not supposed to go and put the sewage treatment plant in any neighborhood, or any health minister or professor and you doctors and all. The entire society's component needs to work together to synergize to reduce the burden of the diseases, and that is what the healthcare system of Pakistan today. I always say it's not the health, it's a sick care system of Pakistan. We are waiting for the patients to come inside the PIMS hospitals and polyclinic hospitals and private hospitals and the government hospitals, and the kind of burden we are having is enormous. We can never have, no state, let's be very clear. I don't mince my word. I'm very clear about it. I don't care who talks what, would blame the community if they don't understand, if every everybody don't understand. My job is to say that and do the right things and keep on doing the right things and keep on doing the same thing, the right thing. What I'm saying, this state of Pakistan will, if this is the phenomena, if it remains there, then I'm telling you, nobody else, I'm telling you as the health minister of Pakistan that there will be no incident in Pakistan. There will be nobody will see that situation in Pakistan that one day the state of Pakistan or government of Pakistan would be able to claim that yes, today we are able to treat each and every sick people who have fallen sick in the healthcare system of Pakistan. That day will never come. Why I'm saying it? The kind of burden we are having, the kind of patient load we are having, if the entire country is the industry or a factory of making people sick, so how many hospitals you will build? In Pakistan, if each and every street has the hospitals, even those hospitals will be obsoleted on the very first day. The way our environment is making people sick. So there's a need to just take the breath, just hold on, just take a rest, just calm down everybody, and then think wisely and see how we can prevent our communities, our human being, our Pakistanis, each and every soul to not to fall sick. This should be the prime objective. This should be the prime concern. This should be the prime target. And see, I'm a politician. I feel happy to see my pictures coming and next day in a newspaper. And how will that happen? If I make a 4 rooms hospitals, BHU, and there'll be, lots of people, media will be there, and I'll go and, cut the ribbon. The next day picture will be all over the newspaper. There'll be headlines that the minister has inaugurated a small hospital and so on and so forth. That will be there. But if I'm sitting in a closed door room and making a plan that how to save people not to come to that same hospital, this will not be shown on any media. This will not be reported in any media. This will not be visible to anyone. I have opted to do the closed door session and efforts to not to fall people sick rather than going and inaugurating the new hospital. Our strategy, our money, our investment for prevention, and prevention is the key, is the way forward. We have to reduce the burden of these hospitals. We have to formulate laws. Just imagine what a country we have. Sometimes I just can't imagine. When we talk about prevention, that means you have to vaccinate yourself. There was a COVID, so everybody vaccinated, right? Then they stopped falling sick. Vaccination came into existence. Invention came in, and then after 2 years, everybody was, going for the vaccination. There was a queue up. When a baby born, we provide 12 vaccination for 12 diseases to prevent from 12 diseases. Then it comes for polio and all. Recently, we have launched this cervical cancer protection vaccine. We are the 151st country in this world. This world has done it 20 years back. 2006, this vaccine was invented. And this was so important and was high profile vaccine that it took long for Pakistan to get it from the world, because none of the country is ready to let this go to any another country, because this is such a precious thing. If you go to Middle East countries, Saudi Arabia and all, if you go to Canada, America, from 7th grade, girls I'm talking about, in a school, you cannot move to grade 8 if you don't have this HPV vaccines done. They won't even let you go in the next class. We put in lots of effort convincing the donors and the world to give us this vaccine. But look what is happening to it. The moment it has come in, all of Latoon has come out, and look what they're doing to themselves. I sometimes get surprised. We don't have enemies from outside, to be very honest, ladies and gentlemen. We are the enemies of ourselves. We ourselves are the bigger enemies of our own people. Nobody could harm us from outside. Whenever people tried, we fought it well. But this inside bickering and negativity is killing us. And it has, like a hue and cry in entire world, entire country about this vaccination. And which in Pakistan, I'm just getting the details, around 25,000 our girls, our daughters are getting this cancer. And out of that 25,000, 75 to 80% daughters are dying every year. In the world, 800,000 women are getting this cancer. After every minute, there's one victim of this cancer. And after every 2 minutes, there's a death. We can prevent our daughters and sisters and mothers from this. But see, there's a misconception. अच्छे खासे पढ़े लिखे लोग जो है वो अजीब बातें कर रहे हैं. So, doctor says, professor says that after 10 years, 15 years, nobody will die due to cancer, because there will be vaccine vaccination for all the cancer. But I think Pakistan will not be there, including in the world map. Here people will be dying even then, because what the diseases which the world has eliminated, we still have, due to this mindset, attitude towards this whole thing. So I would request all of you, professors and all the doctors and everyone, let's talk about prevention. Let's put our efforts and our thoughts and our experiences for the people. This will be used for them not to fall sick, because none of the government ever. Today we talk about all the grievances we have for the government hospitals. How about the private hospitals? There you go to, so the doctors are waiting for you with the flowers or what? There also you have to wait 8 hours, 7 hours if you don't have any contact. All the private hospitals also, filled. So the kind of 25 to 30 patients a doctor supposed to see in the hospital in Benz, they are looking after 250 plus patients. So what would be the condition and what would be the situation? So since I was told yesterday, a couple of days back, then yesterday also, about this very good work, very noble work by Dr. Khalik and his department about having a skin bank and stem cells preservation to deal with the burn victims. I was asking Professor Saab, VC Saab, that how's the situation there in KP? Do we have any proper burn center? He said no. So just imagine all these terrorism when it occurs, the blast, the burning thing, every victim burns victim. So just imagine. So they all be coming here because the first station is Islamabad. So this place needs to be holding a world-class facility to cope all those people, and provincial government should also work in their provinces as well. So on behalf of the government of Pakistan, on behalf of my ministry, I was just talking to Honorable Dr. Saiban that please take me one of your companion. You won't find me lagging behind. Anything under my jurisdiction is there to give you a support to establish this setup for the cure of the common man. I don't read books. I don't read the laws and permissible laws and bureaucratical things and all. Whatever is under my jurisdiction, it is all yours. So take those measures, guide us and improve the quality of this whole burn department in this PIM, and be the pioneer, be a trendsetter for entire country and do something new which others could also follow this too. So with these words, ladies and gentlemen, doctors and people who are sitting here, thank you very much for having me here, and thank you very much for giving me this opportunity. Pakistan, Thank you.